An expert says the current DORSCON Orange level in Singapore best reflects the disease at this point in time. The director of the Communicable Diseases Division at the Health Ministry says making a decision to elevate the level to red would have to take into account many factors.
These include how easily COVID-19 is transmitted in Singapore and worldwide, and recommendations from international health authorities. Singapore, he says, is well prepared to deal with public health emergencies.
The PHPCs have all been trained and equipped with the necessary tools to deal with patients with fever or respiratory symptoms. This is part of, in fact, our pandemic preparedness plan that has been in place for more than a decade. They are equipped to deal with any further spread of disease should it occur. So it is, in a way, a future-proofing. In terms of patients who might develop more severe disease,
Associate Professor Lee was speaking during a panel discussion organized by the Institute of Policy Studies. 4 experts took part in the Facebook Live forum, which touched on how Singapore has responded to the virus outbreak.
Another expert says measures announced in the budget should be largely adequate to cushion the slowdown of Singapore's economy. Economist Barnabas Gan says that that's assuming the virus situation calms down by May, just as it did for SARS in 2003.
And the impact on tourism, though, will still be keenly felt.
The Singapore Tourism Board actually did a forecast that 25 to 30% of fall of tourism arrivals could happen given the COVID-19 outbreak. And if we do assume a point-to-point fall about the same magnitude in tourism receipts, we may see between 6 to 8 million worth of fall in tourism receipts in 2020 alone.